All right. Sweet, we going? All right, so welcome to this webinar. My name's Clayton Edson. What I'm going to do today and what I'm going to share with you is how to pick an insurance policy. Now, I've been running a business for a decade. I started in door-to-door sales and I served a mission for 2 years. Um, After serving a mission for 2 years, I thought, oh man, I never could do door-to-door again. But, after praying about it and spending some time thinking about it, I was like, man, this is probably something I should do to get through college. So went to college in Hawaii, and after graduating there, I knew I had a skill set that I just couldn't ignore. And so I went and interviewed with several companies. And after interviewing several companies, and I interviewed them, one of the things I was looking for was somewhere where I could have culture and I could find honesty and authenticity. And because I feel like that lacks in the business world today. And I ended up landing in this insurance company. And during the interview, this group interview they were doing, I thought, man, if this is insurance, I am out of here. I am not going to do this. And so after about 5 hours of spending time with them in their office, and praying about it, I was like, man, this is probably something I should do, even though I didn't want to do it. And here we are 5 years later, super happy and excited I did it. So that's kind of how I got my start in insurance. I had prayed about it and I interviewed with a bunch of companies, and really I was looking for people to work with that were honest and authentic. Just they were who they were. There was no front, there was no face to it. So that's how I try to operate as a business. My core values, the acronym's HAT: honesty, authenticity, and transparency. And so I tell clients this all the time, and you'll notice this through this webinar, and I'm going to explain government versus private plans, how to pick one out. I'm going to give you a couple resources that are going to be listed at the bottom of this video, so that way when you book an appointment with me, you have a pretty good general idea of insurance, because nobody understands it, really. They go off what their parents said or what their friends said or what they've had through their work, and they don't really understand it. And there's a lot of complexity to it, so you don't have to understand everything. But if I can get you to a point of the basics, if I can teach you the basics and it resonates with you, that way you know what you're getting into and you know what you're getting, you feel like you understand what you have when you hand your insurance card to the doctor. That's all that really matters. So in insurance, and that's kind of my background. So, and this is what I tell people too, is like, I will be honest with you at all costs, even if it costs me your business, whatever that looks like. And I am not a person that has to hustle on Monday, hustle to sell you a policy to pay my bills on Friday. I say that to clients all the time. And they kind of, most people chuckle at it, but they chuckle at it because they understand it, which is like, there's so many salespeople out there that are hustling just to try to get their bills paid. And I try not to make people feel that way. And in the middle of a conversation, and even in the middle of this webinar, when you decide to book an appointment with me or my team, one thing that we'll say to you when we're going through options and we're having a conversation with you which is, hey, if you need to stop and think about it, or you need a couple of days, or you need to check in with someone, that's okay with us. Let's just get you back on the calendar so we stay in touch with you. So when we're having a conversation after this webinar, understand, and even during this webinar, understand that all the information is voluntary, and we're here to be of value to you as much as we possibly can. And that's why we have extremely high client retentions, is because I don't want to start a relationship off with a client by lying to you. The other thing is the authenticity side of me is, I'm wearing a sweatshirt in this webinar. I will when we chat on the phone. That's just who I am. I've got a couple of kids, and this is what I wear every day, because I just enjoy it and I just like it, and it puts me in a mood which allows me to take care of clients. So first thing we're going to jump into is when you're looking at insurance, health insurance, typically you have three parts. You have health, dental, and vision. Health is broken into two separate sectors. Dental is just the network doesn't really matter nearly as much. And so it just depends on the plan you pick and the benefits you want. Network can matter, but it's not as big of a deal. And then vision, it's almost the same across the board. So that doesn't matter. The most pivotal point when you're picking out insurance is the category in which you purchase and the network in which you purchase. And I guess the third, or really, this goes hand in hand. The network of the most important part is the network and the benefits. So someone can say, "Man, I bought a United Healthcare plan. It's fantastic," and the benefits don't reflect that. They might only pay out $50,000 for the course of the year, or they might only pay out, $12,000 for surgery. Those are bad benefits. You don't want something like that. So when people go, I've had this network, or I've had United Healthcare, I've had Cigna, and it was terrible. My response is, well, what category did you buy it in? Did you buy it in the private market or in the government market? And they go, I don't know. And I said, well, are you saying that the company is bad, or are you saying that the benefits are bad? And they said, well, I just didn't have a good experience with this surgery. I said, well, that's probably not a network thing. That's probably not a Cigna thing. That's probably just a benefits thing. So understand that everything in the insurance world is not equal, but I'm going to make it very simple. So when you're picking your health insurance, there's two types of markets. There's government and there's private. Government typically is used when you get a really big subsidy and it's practically free, or it's very, very inexpensive, or if you have some type of pre-existing condition. Now, pre-existing conditions aren't covered by private plans. They can choose to remove your benefits for that or decline you for coverage if they want. And a pre-existing condition, and I know what most people are thinking at this point, and they go, well, I've got high blood pressure, and I've got thyroid, I've got all these different things, or 4 years ago I had Lyme disease, or 8 years ago I had cancer. And most of those things that I just said, or every single one of them, not most of them, every single one of those things I said are not applicable to private plans. Now, if you had cancer in the last 5 years, that would be applicable, not in the last 8. If you had Lyme disease, but you're over it a couple of years ago, again, not applicable. So when you're talking about private plans, there are categories, and the private plans are used when you want to have flexibility. So remember, government plans are when you get a heavy subsidy, and we'll go through this here in a minute, or you have a pre-existing condition, and I'll reclassify those as we go through private plans. And private plans are really used for if you're not getting a subsidy on the government market and you want a PPO plan, or you want major flexibility. You want to travel the country, you want to not worry about what doctor you end up at, or what doctor you get to go to, what surgeon you get to go to. The flexibility is on the private side, but it doesn't cover the pre-existing conditions. So let's jump into that. And I'll show you here. So I'm going to start with the government plan, or the private plans here first. The most common product I use. Now, understand that this is not the only product that we have. There are about 6 different companies we operate with when it comes to private plans, and there's about 12 different policies that we like to use within. And I mean, it can really go up to 30 or 40, but the most common policy that we use is this right here. And what it is it's through United Healthcare. It's called Golden Rule. Golden Rule is the underwriter, but the network is Choice Plus PPO, United Healthcare Choice Plus PPO. So everything about this is United. The underwriter is Golden Rule. We usually do the tri-term plans, and I put up 3 here for comparison. And the way these work is they'll last for 3 years. So if you have a heart attack on it, you get to keep it for the next 2 years after that. If you say you have it in the first year, and you can stay on it for as long as you like. The deductible would be $5,000, and this is flexible. We can go to whatever we want here for people. If they want to decrease your premium, you can go down in deductible. After you pay that, your co-insurance is 100%. It's 100-0, which means the insurance company is going to pay 100% of all of the premiums after that. We then also have an attached accident rider. So what that means is if you have an injury of any type, the insurance company will actually pay for the entire $5,000. And same goes for any deductible that we give you. Any deductible that you get, you will not have to pay for any injury. Now, Clayton, how do I know if it's an injury or not? Insurance companies, hospitals will bill insurance companies in two categories. The two categories are sickness and disease and accident injury. 80% of claims are accident injury related. And so I just had a client on this who her son broke his arm. And she's like, man, I'm going to pay thousands of dollars. I have no idea how much this is going to cost. This is going to be terrible. But I got to take him to the ER. She shows up at the ER. They go through it. They process the insurance policy. The billing department comes back to her and says, all right, here you go. Here's your bill. Slides it over to her. It's a $20 bill. And she's like, $20? Why $20? And it was for the sling. Because the sling is not billed as an injury, but it was billed as medical durable equipment. That's probably a little more detail than you need. But the point is that she didn't have to pay a dime because of the way we design our policies here at AZ Health Insurance Agents. So when you're getting a private plan, we will gladly show you all the options, but a lot of times what we do is we want to make your experience, the client experience, as smooth as possible when you use it. Now, there's only 2 downfalls and 2 complaints that I end up getting from this plan, and that is, 1, doctor visits are subject to the deductible. The doctor visits, when you go to the doctor, you always get contracted rates. So if you go there and let's say they want to charge you $200, you're going to get contracted rates for $100. You're going to end up paying $100, and that's it. And that'll go to the deductible. That gets to meet that deductible. Now, the other complaint I get is physicals and colonoscopies are not covered. Those are subject to the deductible. Now, if you have a mammogram or a pap smear, the insurance policy will give you $200 per year to cover that. So women's wellness is free. Physicals, not so much. Those are the two biggest complaints that I've ever gotten. Now, retouching on the deductible as well. Remember the other category I said was sickness and disease. Your deductible is $5,000. If you have a heart attack, cancer, stroke, that is the only way you're going to pay that. Heart attack, cancer, stroke, appendicitis. If you need an MRI on some cysts that you might have, developed, that's when you would meet that because those go in a different billing category of sickness and disease. So in a nutshell, that's kind of how private plans work. And the last thing to really touch on too is, there's a $2 million lifetime maximum. You're never going to meet that. After contracted rates, I don't even have cancer clients that meet that. So kind of just an asterisk at the bottom, but nothing really to be concerned about. Now, on the government side of things, I want to show you someone who doesn't get a subsidy. So and that, by the way, on the private plan, that premium was based on 4 people. Okay, it was based on a family of 4, a 30-year-old, 36-year-old, and I think a 4-year-old and a 3-year-old. And that was this is a client that I actually had, and I'll show you what I gave them here in a second. I actually gave them on the government side of things, but I'll show you how I designed everything for them. And the process I'm taking you through on this webinar, by the way, is the process I take every client through. And I ask them questions as we're going through so that we can solidify what you're hearing so you make sure you understand it. So let's say we go to the government plan and you make $200,000, $300,000, or you don't get a subsidy, and your silver, the marketplaces are very expensive when you don't get a subsidy. So the private plan I just showed you was a deductible of $5,000 and everything's covered after it. The government plans are $1,000, your deductible is $5,900, and the max out of pocket's $9,000. This is assuming you don't get any subsidies at the moment. The biggest difference between private and government is private is always going to be a PPO, and the government plans are always going to be an HMO. So the question is, well, if I don't get a subsidy and I'm not sick, should I do the government plan? The answer is no. Okay, well, how does this make sense? Well, here's how it makes sense. If you are a family of four, that same family of four, and you're making $60,000 a year, look what happens to this government plan. Your premium goes from $1,000 down to $0, the deductible is $700, and the max out of pocket is $3,000. Most people at this point in time have their jaw drop. They're like, wait a minute, what? I haven't heard about this. And some people have, some people haven't, and some people have bad experiences with the government plan because some agent didn't set them up right or didn't tell them the truth. Again, honesty is our number one policy. So as we're asking you questions to get your income, to understand what's the best option for you, we're going to show you literally everything. And so you can get this family, you can get a Blue Cross Blue Shield for $0 with a $700 deductible and a $3,000 max out of pocket. Now, below this webinar, there's going to be links to this platform. So you can, before you get on the phone with us, after you've booked an appointment, and once you get on the phone with us, you will have had an opportunity to play around with this platform and software if you want to see if, hey, maybe I should do a government plan or maybe I should do a private plan. And you can educate yourself a little bit with it. So again, this covers all pre-existing conditions and it gives subsidies. And notice too, and I don't know if you noticed prior to, but the co-pays for the insurance have dropped. Now, the other thing to note on this is that wellness is free. Wellness is always free on every government plan, no matter what you pick. Okay? So those are the big things between with the health insurance. Government and private. Government is HMO. Government can be subsidized. Government covers pre-existing conditions. Private is always PPO. It's going to cover you anywhere you want in the country, and you can typically choose your doctors and will be less expensive than a government plan if you don't get a subsidy. And everybody has their own reasons for picking, right? So some people might say, if I were to say I put this family at, let's say I put them at $120,000 a year, right? This plan is going to come in at $700. And here's the deductible, here's the max out of pocket. And they might say, well, hold on a second, the private plan was the same price. So why don't we just go with the private plan? Or if I put this at $100,000, they might say, well, yeah, it's $300 but less, but look at what the deductible is and the max out of pocket, and then I don't get to choose my doctors. So you're going to be able to have the flexibility to choose and pick whatever you want to do. Now, the other two parts are very simple, the dental and the vision. Dental, we have a proprietary product that we like to use called Apex Dental. The network is Dentamax PPO. Dentamax Plus PPO, excuse me. The reason I like this policy is because the rates are flat and in place. So if you're an individual and you want $5,000 of coverage for dental, it's going to be $56 a month. A member and spouse is $100. Member and a child is $112, and then the family is $160. There's these other options if you want to go to $1,500 in coverage on the left-hand side. The middle is $3,000. But if you're doing a family of four, I mean, you're getting dental for $40 a person on this. The difference is there's no deductible. It's just a copay. So when you go in to get a teeth cleaning or get a root canal or crown, you pay $25 rather than having to meet your $100 or $150 or $50 for your deductible for the year. Now, there is one other thing that I am going to pull up, and this is more of a, if you want to pause the webinar here, this is something that you can take a look at, and I will move this. This is also something cool about Apex is you can waive the waiting period. if you've had dental before, or if you've burned through a lot of dental coverage. Okay, you can take your insurance card, send it to us, and we can waive the waiting period, and you could still keep whatever you had, whatever you just got a bunch of work for. So, and really, it's really standard: 80% coverage, no waiting periods, 50% for major care. And so here's the pricing to it. Now, the vision is always going to be standard across the board. It's $11 a month for a member, for member spouse 20, member child 21, 22 really, family is 27. Now, these are called, the vision, like I said, is pretty much the same across the board. They're called 10, 25, 150. 10, 25, 150s. And what that means is it's a $10 copay for an eye exam. You have a $25 copay for lenses, and then you get $150 for frames, or you get $150 for contacts. Now, this only starts on the first of every month. That's very unique to Apex. Now, there's other dental products we have called the Meritos. This will start whenever you want. There's no waiting periods. Some people like this when they want to have that option to start the next day, and maybe they have a root canal or crown they have to get done. But in this case, same family of 4, it's $21 more than our Apex, and if you'll notice, the maximum benefit is $3,000. If you look at the vision plans, the same vision plan basically is $44 a month for the same family of 4. So instead of 27, it's 45. If you can wait a little bit, then it's worth it to do the Apex. And 99% of people can wait. So, and this is actually a 10, 20, 150. This is just a $25 less copay on the eye exam, or on the lens copay. So, in a nutshell, everything is boiled down to 3 things: health, dental, and vision. And the thing that matters the most is government plan, government market versus private market. And you're going to know what you want to do. You're going to know probably what's the most important thing for you. Now, we have a full staff. I encourage you to get on the appointments right away, because our calendar fills up really, really fast. Sometimes it's a day to talk to us, but most times it's 2 or 3 days. I've had it during open enrollment. It's as long as 2 weeks. And so I would encourage you to get on the calendar as fast as possible just to chat with us. There is no pressure. We are here to help and serve, but we want to take care of your needs as needed. So at the bottom of this webinar, you'll see the link to the government plans. Also the Apex. Let's say you don't want to chat with us. There is an enrollment link for the Apex Dental. It's very simple. It's very straightforward. If you want to use that, you can sign yourself up. But we'd still love to chat with you and talk with you, even if you're like, well, I've got my health in place, but I just need my dental, and I don't want to talk to anybody. It's fine. You can go ahead and use the link. But we'd still love to chat with you, even if you have your health plan. We don't want to talk you out of anything you like, but we would like to see if that we can put you in a better position. So please book on the calendar with us. Please come talk to us. If you see that you can talk to us today or tomorrow, I'm telling you, that is not normal. So take the appointment slots before they fill up. It's super worth it, but we treat everybody like family, and we would love to take care of you. And to the last thing I'll say to this as a capstone is, if you're sitting here thinking, man, I already got insurance through my work, I'll tell you, the biggest thing you can save money on is not getting insurance through your work for your family. So if you're a family of 4 and you're like, man, I already got my family covered, I can tell you a lot of times you're being overcharged, and a lot of times as the employee, you're going to be free, but your family is going to cost a great deal of money just to keep them on there unnecessarily. So again, book an appointment with us. We're not going to talk you out of anything you have, but we would love to see if we can be of value and of service to you. And if you see that there's only like a 1-day wait period, or you can even talk to us today, take it, because it fills up fast every single day, every single week. And the closer we get to open enrollment, sometimes it's 1 to 2 weeks to talk to us. So I hope this helps. I hope this webinar helps. All the links will be at the bottom. And I hope that it helped clarify any confusion or a lot of information that you may have not understood in the health insurance space. I hope you have a great day. Bye bye. Bye bye.